Do you suffer from foot or ankle pain, knee pain, hip pain or back pain? Hi, my name is Roger Reid. I'm a chiropractor. I work in Paddington, London for over 20 years. I have a special interest in feet and foot biomechanics and how they relate to injuries of the lower limb. I treat metatarsalgia, plantar fasciitis, Achilles tendonitis, patellar tendonitis, iliotibial band syndrome, lateral hip pain, low back pain and neck pain. Basically, I'm a mechanic of the spine. I look after the body and all the moving parts.
I'm a former runner and triathlete and was unable to do any of those sports with my injury. I came to the practice because I had a knee injury. I couldn't walk at all. I was very depressed and very inactive, and I gained a lot of weight. Roger soon sorted the knee pain out and I got back to walking. It helped with my mental state. In fact, it changed my life.
As an athlete, a triathlete, an adventure racer, an obstacle course racer, I'm particularly interested in feet and foot biomechanics and how they relate to injuries of the lower limb and the low back. As a chiropractor, I'm interested in the little bones in the feet and the joints. There's 26 little bones in each foot. Ankle joint needs to move nicely, and then the mechanics flow really nice and easily, and there's less stresses and strains on the rest of the body, on the knees and on the hips. I can get in there and adjust those. Now, there's two different ways that I can adjust those. I either use an Activator, which is a small handheld gadget that does a little mechanical thrust, a little punch, and that loosens up the joint in the foot. Also have another technique where you get a little audible pop, and sometimes I'll use a combination of both those techniques to get the joint moving and restore function to that joint. We also use exercises, stretches and strengthening exercises to try and improve the mechanics.
So I brought my eldest in to see Roger when he was complaining about problems with his feet, playing football and a lot of sport when he was about 10. I think it's to do with the bones in the feet not quite catching up with the rest of how the children grow, and we had orthotics fitted. Having some treatment and also having the Gaitscan and the orthotics fitted for him really helped and enabled him to continue playing sport as well.
One of the things I treat a lot of is overpronation of the foot. This is when the foot rolls inwards, and when it does, it squashes the plantar fascia and it pushes the big toe off to the side, causing bunions and metatarsalgia and plantar fasciitis, sometimes Achilles tendonitis. Also puts a big twist on the knee, and the iliotibial band on the outside then has to work really hard to try and stop the knee from collapsing inwards. And this can put a pull on the low back and on the hips and change the mechanics all the way up. You also get much less shock absorption when this happens. What we do for that is we make a little orthotic with a little arch support, and we improve the mechanics by putting a little wedge on the inside of the heel, put the foot into a neutral position, which then straightens up the knee and improves the mechanics of the knee and takes a lot of the stresses and strains off the knee and the hips and the back.
I had my orthotics 5 months ago. That has changed the way I walk. I don't have any pain anymore, and I'm back to really tough exercising, and I think I'll be back to running in the next month, which is phenomenal.
For chronic tendinopathies, we have radio shockwave therapy. This is an excellent form of treatment for plantar fasciitis, Achilles tendonitis, patellar tendinopathies, as well as tennis elbow, golfer's elbow.
From the moment I stepped in the door, I've been on a journey. My mental and physical health is, I can't describe how much better it is. I'm doing things that I've never been able to do before in my life. I'd like to thank Roger for changing my life in a positive way, in a very positive way.
As an athlete who understands the rigors of training, as a chiropractor who can adjust the joints in the feet and get things moving better, we can also offer exercises and stretches. And then for those indicated, we can make orthotics to correct the mechanics. We also have treatments with the radial shockwave therapy. So we're a bit of a one-stop shop for mechanical lower limb problems.